Okay, so good morning, one and all. Thank you for joining us today, and so happy to have you all. So today's session is very, very special because we are, for the very first time, we are bring on a very special person who's from the medical fraternity. You guys have keep hearing from a lot from the nutrition community now. Now you're going to hear the things from a medical doctor. So it's a privilege today that we have got Dr. Pavan Kumar sir here. So let me introduce about
Ma'am,
his.
sorry. Please go live.
Uh, Swapna, go live. Sirisha, please coordinate. Yeah. So thank you so for being here today. So let me introduce. So let me introduce today's speaker for you all. So we have Dr. Pavan Kumar sir here. He did his MBBS from Andhra Medical College, Visakhapatnam, and he did his post graduation in radio diagnostics from Guntur Medical College. He has 17 years of experience as a consultant radiologist. He started his career with Vishaka Diagnostics in Visakhapatnam and worked in towns like Kakinada, Anakapalli, Kambam, and now settled in a very small town in coastal Andhra called Palakollu. He's an accomplished chess player and a tennis enthusiast. He took up running as a hobby, and now, to his credit, he has got so many half marathons, full marathons, and even ultrathons. He loves reading, and his favorite books are Fountainhead and Atlas Shrugged by Ayn Rand. Known for his witted humor by his friends, and he's equally passionate about primary and preventive health care. He's one of the key founding members of Holistic Nutrition Training Program. And with this brief background, we welcome you, sir, to today's session that we are going to talk on more of preventive health. Happy to have you, sir.
Yeah, thank you very much, madam. And it's very happy to hear uh, that I did all these things. Uh, just right now, I'm looking back. Oh, did I this? Did I do this? It was like this. It was definitely a great introduction for me, and I'm very happy to hear all those things. Anyway, everybody feels happy when you hear something good about you. Okay.
It's a great journey, sir. We are going to hear a lot
Yeah.
from you.
Yeah.
So to start with, sir, you're so much into various sports and marathons, and it's usually we see doctors being very busy, and doctors don't have time. So you've been doing so much into this. So can you share your fitness journey, the motivation behind your story of doing all these things to our audience today?
Actually, it was like right from my early days, or I could call it childhood days. I used to do something or other thing. I cannot take rest or simply stay idle. So whatever might be you call fitness or something like that, it's just a byproduct of what I do passionately. If I go for swimming, I go with passion. I wake up early in the morning. I'll sleep with the thought of swimming tomorrow to beat somebody or to get some new record. And after some period of time, when I feel I got bored and it's been a routine job, then I stick to tennis. And like that, right now I'm into running. Maybe some other day I'll be into some other thing, but I don't know. But somehow I'm interested in doing something physically, which I'm trying to find out my boundaries always, and I try to push those boundaries. In that process, I get fit. It's not about. It's never about fitness. Fitness is just a byproduct of what I do passionately.
So
And
wonderful, sir.
yeah,
So
yeah.
it means, guys, this is not something that we have to specially do. When you love something and when you do it, when that becomes your routine, and when we want to go beyond that, That's what is reaching beyond the boundaries. We achieve stuff like this, which Dr. Pavan sir has gone through with so many marathons and half marathons. It's not feasible for a common man unless otherwise there is a lot of inspiration and motivation behind. So having said that, sir, there are so many people still think that walking or running is only for people who are with some ill health. Okay, I've got diabetes, now I should start walking. No, I have got overweight, now I should run and get rid of this weight. So people are still with that misconception that exercise or fitness is something related to disease management. So what is your take on this?
Yeah, it's something like that. If you went to any cardiologist or any a good physician who is concerned about preventive health care, after all his prescription, they used to write just walk 30 minutes a day. So we made it a pill. Actually, what is a natural process? You should walk. Your entire body is designed to walk and run. But somehow we forgot to do that, and somebody has to advise us to walk. So now it is in the list of prescription. So it's definitely a treatment for a disease. It has become like that, which is very natural. So doctor is saying that you have to do some natural work, okay, to get your health back where you lost because you are not walking, you lost your health, and go just walk for a while and you'll find your health. That's the only simple logic. So whenever we go to park or something like that, we used to see old guys or some people with arthritis slowly moving or doing like that, and everybody used to talk after. Okay, I got this diabetes, I got this hypertension, so at least I should take 2 rounds or 2 kilometers, something like that. They used to keep goals like that. So after hearing all this stuff from our parents or grandparents, and we used to think, okay, when I got diabetes, then I should start walking. So it's not for me. So we made it as doctors, we made it to the list of prescription. So it's definitely what that's how people perceive it. Somebody is jogging or somebody is walking, maybe he's having some disease and he's trying to get rid of that.
Okay. It is, I see the other way around, sir. Instead of people are into so much of inactivity that they
Yeah,
forgot even being active, at least we are to
yeah,
be thankful to doctors. At least they have made it a prescription pill that even walking can become a
yeah.
prescription pill so that people realize the importance of it. So, having said that, like if someone really wants to start new, they have never
Yeah,
been and they
yeah,
want to start new. So, what
yeah.
would be your advice to them?
Irrespective of your age, your weight, or whatever might be your health condition, unless someone is having some serious cardiac issues, anybody can start from any day. I should always suggest you do an activity where you feel passionate about it and where you can keep some goals. Not like it should not be according to international standards. It should be according to your yesterday standards. Yes, at least you should cross that standard. Your border is always you, yesterday you. You have to pass on your yesterday you to become tomorrow you. So I suggest everybody, anybody. I just if somebody asks me, sir, how do I get fit? Should I join you for jogging? I'll just say, are you passionate about walking or jogging? He says no. I used to say, if you are not passionate about it, just find some work, some job, some game. Just join. It's not about your use. I'm 50 years, sir. How can I join tennis? Can I learn tennis? Anybody will take me as a student. They'll ask like that. They'll definitely take. It's not like that. You cannot learn tennis after 50 years, after 60 years. You can do whatever you want to do because you are not going to beat the Federer. You are just going to beat yourself of yesterday. So I suggest anybody of any age, any gender, provide with an exclusion of severe cardiac disease. They should do and they should enjoy that process. It's not that it should wake you up in the morning with a certain goal. As kid wakes up in the holiday, you can
Hmm.
see our kids waking up in the Sunday morning because they know there's a lot of things to do. There's a lot of fun to do. That's how the day will start. Okay, if you are passionate, you start an activity where you feel passionate about it, and your entire day will be very happy and energetic. It's
Wonderful,
not
sir.
like that running or any certain activity.
Yeah.
That's what my suggestion.
Right. So very well put it across, guys. So, guys, I hope you all have got the message. It's not that you start with your friend or companion or colleague. Definitely, you can pick a partner because that becomes a good motivation. But you should start your own journey where you are. Check yourself. Where were you today? And where you want to go tomorrow. That should be the base for you to actually start something. Running behind someone and leading a second hand life or leading someone else's life will always put ourselves in risk. So let's not do that. Let's analyze yourself before you start. So having said this, since I'm talking to your doctor, I wanted to ask you one question. Like when a person has a lot of illness or like they're not well and they go to a doctor or they go to a multi-specialty hospital, and people see doctors as gods, but when it comes to the billing counter, when they have to pay the bills, the picture totally becomes upside down and they don't see the same scenario. So how do you see the healthcare system today? What is your take on this?
Actually, it's like that if somebody is having a terminal illness or any serious condition, they have to be kept in ICU and they should get very costly medications and all those things. When the patient is in a serious condition, whoever the person takes care of that patient says, please, sir, do something, do anything. I need my person to get alive back. And after that, he never thinks about the bills or something like that. When he is paying the bill, and definitely he feels there is a lot of pain. Whenever it's a lot more pain, it gives you a lot more pain when you are losing money than your health. So it's in both ways. Some hospitals you can see they charge like anything, but there is no option for you because you are landed up in certain hospital and you don't have time to shift to some other hospital, and you don't know what will be the price in certain hospital and what disease you got. It doesn't come with a price tag, so you don't know what is going to be the price. So it's always depending upon their final financial condition. It's always tough to pay the bills also in their part if you see in their from their part. But the better thing is we are able to bring back so many lives. Otherwise, you can forget about them. It's in both ways. Definitely, the bills are hefty. Uh,
Yeah. So, now, why I'm specifically asking this question is when people end up into a kind of situation which is unavoidable, there is
yeah,
no way to look back. But
yeah,
how we can avoid that particular situation and restore our health from the very beginning is the topic for today.
yeah.
So there are various conditions across. Probably I would like to pick and talk about three or four, which are majorly we see across. So my question to you is, since you are into the radiology and diagnostics, we get to see a lot of arthritis cases a lot. So what is your opinion on the trend that is going on these days on arthritis, sir?
Yeah, actually, when I started my practice 16 years back or something like that, we used to see arthritis cases in a patient of 50 plus or 60 plus. It's like that when we are doing our post graduation as a student, if you write an arthritis diagnosis in a patient of 30 years, you'll get failed. The examiners won't see the radiograph or X-ray, and he says, "Have you seen the age of the patient?" He asks like that. Okay, 30 years. How can you expect arthritis in a patient of 30 years? But right now the trends has changed. You can expect even in 25 years also. It's just because of our sedentary lifestyle and obesity and stress. All those things are adding up, and the disease process is coming forward. It's catching younger population also. There is a misconception that always people think if you overuse any joint, you will get arthritis, but it's vice versa. If you underuse or if you misuse, That means if you keep your joint in a wrong position, or if you keep your joint in an ideal position, those are the conditions that will make your joint degenerate early. So here also, the only pill is walking or jogging or just using whatever the joint you have, because it's designed for that. Okay, your entire body is designed to move, and you have we have stopped moving from so many years. I think at least 10 to 15 years it's been. Nobody is moving across the road. You cannot see. Somebody stands on the road and shows like this, and he lives for 100 meters to just to travel to 100 meters to that junction only, sir. He asks like that, sir, can you drop me to that junction? That's only 100 meters away. He can walk that. But we are trained or accustomed to the technology or whatever the facilities we are having, only to put ourselves in danger zone. That has to be changed.
Right. Right, sir. So absolutely. So
Yeah.
guys, I hope you got the message. Like it's not the overusage, it is the underusage or not at all using any of the muscles is what landing us in this position. So the only way and the very important way to get rid of this is start moving yourself. So there is one more related question to this. Since you work a lot in the rural areas, and since we see a lot of agricultural laborers and other daily wage laborers who work all through the day, there is a lot of physical labor that is involved. And in spite of that, I see their health is very much, they are in a fitter and more stamina we could able to see. Whereas when I see the urban counterparts, though people are not much into any of the exertion, that but still the fate of illnesses are a lot, especially for back pain. So how do you see this, sir? Like, is it the same in the rural area setup? Is the first question, and how we can deal this in the urban setup is the second question.
Yeah, it's like the question, I can put it like a software engineer sitting in his chair and a agricultural laborer doing some hard work. It's like that. I used to have MRI scans, where we call that paraspinal muscles, the muscles which use it to support the
Hmm.
muscles and discs from taking the weight of the body. Actually, we stand or we sit erect because of the spine. It just only gives you the shape, but the strength comes from the paraspinal muscles. Okay. Hello.
Yes, sir, you're audible.
Yeah. The strength comes from the paraspinal muscles, and that means muscles which run parallel to your spine on either ways, from anteriorly means front and on back side posteriorly. If you
Okay.
happen to see an MRI, an
Hmm.
agricultural laborer who looks very lean and thin has a
Hmm.
3 times stronger muscle or thicker muscle than a software engineer who is around 25 years old.
Right.
So what it means is not at all moving. Again, the thing is, it's we call actually people call osteoarthritis or something like that. But we in radiology or something we call it is a musculoskeletal system, not skeletal system. Both are in both are intertwined like a tent house with its ropes and those pillar like rods. So it's like musculoskeletal system. You as you strengthen your muscle, this the spine gets or bone gets less amount of weight to less amount weight it takes from your body. So it is more protected. If you train your muscle, they'll protect your vertebral discs, or usually you happen to hear L4, L5,
Hmm.
L5S1. All those things are because of not because of your disc, but because of the weakness of the muscles, which are almost sometimes in an agricultural lab. Those muscles. There has to be at least 4 muscles on either side. Those
Hmm.
muscles are thicker than the vertebra itself.
Okay.
Whereas in a software engineer, you can rarely see them. They become like a ribbon.
You're right.
Yeah, so it's like that. I rarely find any disc prolapse in a 60-year-old patient who is a laborer.
Okay.
They might be having some back pain. It's definitely because of some other reason, not because of I rarely seen any disc prolapse or something like that, or even degenerative changes also are postponed in laborers. Laborers doesn't mean literally laborers who can do certain work or who can move his muscles, can protect his bones and joints. Every joint is supported with a certain group of muscles. They'll take care of that joint. When you weaken your muscle, the only thing is you are taking weight onto your joints and encouraging to get degenerated early. There is one analogy. Uh, you might be knowing everybody right now, everybody is having a four-wheeler. You know, the alignment of tires we used to do regularly.
Mm.
What happens when you don't align those tires? Some of the tire will get most of the weight, or it will what you call
It becomes
it will lose.
uneven and
Yeah,
imbalanced.
yeah. So it's like that. You have to align your body so that nothing will get degenerated.
Right.
Yeah, it's all aligning your body. Okay, you take care of even subconscious alignment. That's a different topic. And
Right.
I'm just talking about this conscious alignment
Right.
of keeping the muscles of all the joints with support, all the joints. If you take care of them, they will align your joint in a proper position, and your degenerative changes will be pushed back at least 30 to 40 years. If your father is having degenerative arthritis at 60 years, you cannot push it to 80 years if you are active.
Right.
Yeah.
Wonderful, sir. So, guys, I hope you all understood the ground reality. When we don't actively move around, when we don't put ourselves into an active mode, we are eventually unknowingly losing our valuable muscle. And when we are losing this muscle, whereas in the other side, for the people who are working hard, they're making their muscles stronger. And these stronger muscles, in turn, they're protecting the bones. And together, they're able to have a better musculoskeletal system. And that's what avoiding, protecting people from not getting the slip discs and back pains and all the kind of spondylitis issues and all these things. So the only mantra to come out of all this thing is stay active. Take some inspiration today from our dear doctor. So, as we spoke about arthritis and back pains and slip discs, and there is one more major health concern that we are seeing these days, doctor. It's about women, and we see a lot of PCOD cases. Like if I see in urban region, it's almost if we see 4 to 5 people, one is having this, and many of them they don't even go to doctors. Some they go directly to the scans also. Get the ultrasound done and
Yes.
check them by themselves. So how is the setup in the rural India? Like how do you compare both the scenarios, and what can we do for this?
Yeah. When you compare from with the rural crowd, it's definitely less frequent in or has a less prevalence in rural areas, because here the people used to have less stress, they have lesser goals, and so all those stuff. So one thing is you will always feel like retired in villages, as I'm sitting right now. Even though you are working, you feel like retired, and that means you are stress free. You are the boss here, okay? Because you are the only person that may be sitting over here. That's a different story. But there is a less, always there is less stress in smaller cities or villages. So there is disease burden is relatively less, but definitely PCOD is going everywhere. It's catching up everywhere. One thing is because of this junk food or obesity or something like that. And another thing is uh, human body or any other body, any animal body is never designed to take so many menstrual cycles. Because of our cultural or our developmental changes, as we have to move with the culture or whatever the trends or styles are going around. We have postponed marriage or childbearing ages and all those things to a very far extent. Actually, a girl child comes around 13 to 14 years, menarche age will be around that, approximately around 12 to 13 years. And after that, good olden days, okay, it comes like good, but maybe it's not good. I don't know. But olden days, what happens is, they used to get married that child. Okay, probably they used to have 3 or 4 periods. They used to get pregnant, and again they give milk to the babies. At that time also, it's called lactational amenorrhea. So means whenever the mother is giving milk, she won't get periods. And after that, in between, she doesn't know. She became again pregnant, and the process goes on like that. It is the nature's design, not our design. It's nature is designed like that. We are intervening. We are changing that thing for the social growth or development or whatever you call. Maybe for the girl's point of view also, to make her more healthy, or to have her a personal life. We have made so many changes from the nature. I'm not saying that's good, but whether it is for good or bad, you have moved from your village like that. You have moved from your nature. We all have moved away, lot away. And now we are become so much eccentric. We don't know where is the center, and we don't know how to go there and how to deal those things. Now you see, a woman attains menarche at the age of 12 to 13 years, and up to 45 years, she used to get every year 12 cycles an year. But your body is designed approximately take 10 to 20 cycles of your entire lifespan. So physiologically, that is the thing. I think that is the thing that made the hormonal imbalance. That is the most important cause. But it cannot be reversed. I don't know what to do with that. It cannot be reversed. That's what I feel is the main reason is that
Okay.
human's body is exposed to so many cycles where it is not designed to, where or it's not conditioned to deal such a type of stress. Having multiple hormones circulating on the body itself is taking a drug every day. It's very active metabolite. You know that hormone is a very active substance in our body. So that might be the most important reason, what I feel.
Right, sir. So one thing you said is moving away from nature. Um, as I'm listening to you, I was recollecting a story of my maid. Like she delivered a baby girl a year back, and suddenly she started working again. And after 5 6 months, again she said, "No, I'm not well today. I went to doctor and I got to know like I am 6 months pregnant." She's not even aware. So this scenario is still there. We don't deny the fact that everything has changed. There's still the rural suburbans of the cities and the most of the places. This is still established that people don't know, they don't track their periods, and they are not aware what is happening with their bodies unless otherwise we see an end result. But having said that, even the usage of external pills and the birth control pills and a lot of stuff which are interfering with the system, what is your take on that, sir?
Yeah, it's definitely adding more burden on your system. I'm always against these hormonal pills, but the thing is, you cannot change your lifestyle. This is where actually your kind of treatment helps. A holistic approach can change them. But as you know, people are not interested in doing a positive things or a positive habits. It's very tough to cultivate positive habits, and it's very easy to take a pill. So whatever is easy, they are picking that.
Right.
So actually, we have developed medicine only to help the people, but they are taking the help of the medicine only so that they can stay lazy.
Yeah, as I'm hearing you, I was recollecting the dialogue from Shah Rukh Khan's movie Dilwale Dulhania Le Jayenge. There are always two ways. One is a quicker and easy way. One is a harder way. So if you pick the harder way, you will reach it late, but you will sustain your results, guys. So this is a takeaway message for you all. And as we said that, sir, I have one more interesting thing to talk on today. Um, Earlier days, when people used to become pregnant, there used to be any scans. In fact, if I go back to my mom's era, when I asked them, when I talked to people, my grandparents and my parents, they said they hardly used to do any kind of scans. Coming to my generation, like my daughter was born in Switzerland, so I hardly they have done maybe one or two scans for me. But whereas recently, when I see the system in India, the concept of doing pregnancy scans has totally changed. Earlier, we used to go for the scanning just to check whether the baby is healthy or not. Now, if I see the list of scans and the purpose of doing the scans, it is basically get this scan to get to know whether your baby has developed well or not, get this scan to know whether they have Down syndrome or not, get this scan to know whether they have some anomaly or not.
Anomaly.
So, what the perspective, I mean, why the kind of scans that we are going to do, and the total scenario has become upside down, and it's really, really so painful for us to see the things that are happening. So, what do you say on this, sir?
Yeah. On a lighter note, I'll tell you one thing. Recently, one patient came to me. Sir, you are here. I'm very happy. Today is my delivery. If you are not here, I'll be worrying too much. You came early. Thank you, sir. Thank you very much. I said, okay, what if there is no radiologist in the city? Or what if there is no scans today? What will happen? What do you think? Will your child is not going to come out? Even I asked them, what if there is no obstetrician or the gynecologist? Gynecologists go on a strike on one day. What happens? What happens on that day? Will the babies will wait for the gynecologist?
No.
No, because it is the natural process. It is. I always used to say to the. I never call a pregnant as a patient. I trained my staff also like that. They are not patients. Okay, they are the natural carriers of our genome. They are bringing back one more life into the one beautiful thing is one more life into the this world, and they are carrying our DNA, our species, the very sustain, very reason of our existence. So it's a wonderful thing. It's not a disease. First of all, pregnancy is not a disease. It's a wonderful thing that is happening in this world. So even if you don't have a gynecologist, you will get baby. So then why do we go for a gynecologist or why do we go for a scan? It's just like that. Taking more, you are having more knowledge, and your effort, you can afford to purchase that knowledge, or you can afford to take that knowledge from someone else. Then go for it. That's it. It's only more knowledge that is helping 5 to 10% of population. The rest of the things, 90% of the babies will come out, whether there is a gynecologist, there is a radiologist, they don't wait for us. It's a natural process. They'll just come, even in the middle of the forest, middle of the night, wherever you are, they don't bother about that thing. That is the process happening in the entire world. There is no gynecologist for any animal except humans. There is no radiologist for any animal. But having said that, coming to the technical point, technicalities of doing scans. First of all, I definitely say people are writing too many scans, which are definitely not necessary. Whatever the scans, I should be frank enough to say, what are the scans I am doing today? At least 20 to 30% of them are unnecessary, not at all necessary. Uh, Only because one thing is, a patient asks for a scan, or doctor thinks, what if I don't write this scan? On a later day, he might land with some other problem, and he may file a case in the court. One thing, he's writing scan not to save the baby, to save himself from the patient, right? First of all, we are not saving the patient from the disease. First, we try to save ourselves from the patient. It's like recent defense mechanism, like an evidence-based medicine. So that I wrote that scan, so that scan shows this thing. According to that, I done this. So whatever the wrong happened, I did all the things that are prescribed in the textbook. So I'm on a safer zone. So that's the thing. That's why there are a lot of scans are doing today. We are coming to the technical points. What are the scans needed? First scan is you should get a scan after you miss a day of periods by around 10 to 15 days. By that time, we can know, first thing we should know is whether the pregnancy is within the uterus or outside the uterus, whether it is a single or multiple pregnancies, which is very useful issue because a person is having a pregnancy outside of the uterus that you call tubal pregnancy or something like that. It's a very dangerous condition. Patient may die on the table. Suddenly, they can die. If it gets ruptured and bleeds like anything, as though severely cut artery from wrist or something like that, they bleed inside. You don't know how much bleed they had in their stomach. Your stomach is having a capacity of 5 liter. Your entire blood can drain into your abdominal cavity without any notice because you are not able to see any drop of blood outside. It's within the blood. So first thing is you have to check whether the fetus is growing inside the uterus or outside the uterus. That is definitely a needed scan that we call an early scan. And another thing we ask for is NT scan, as you said, Down syndrome screening scan. That can be done around 11 to 13 weeks. Uh, and okay, it helps to some extent, but not as people think. It doesn't, frankly to say, it doesn't screen 95% of the Down syndrome babies. It just let them grow. And it makes about 95% of the normal babies. If we give an abnormal thing, we call nuchal thickness means the neck skin thickness. So the soft tissue behind the neck, we take that thickness. If it is more than 3 millimeters, the chances of having this child will be 5 in 100. Means 95%, it could be okay. There is a possibility of 5% it's going to be a downside. Then what happens if you do abortions for all those fetuses? You are killing 95% of normal population. So it's again, it's only for the recording or what you call defensive mechanism from the doctor. He should write an anti-scan so that he has done what is written in the test. You call it as a necessary or it's like a I don't call it as a mandatory test, but it's okay to get it done. And another thing is anomaly scan, as you mentioned. Anomalies means, is there any abnormality in the baby? That is the beautiful thing that's happened with the ultrasound scan. I'm very fascinated by that. Every day I do any scan, I record a very small subtle finding, which might not be useful at all, but I'll write it down and check after the delivery, how is the baby is doing. If the gynecologist is close to me, I ask them, how is the baby, ma'am? I give this finding, this finding. She's okay, fine, okay. Then good, okay. That means, okay, this finding is okay.
Wow.
It's like that. I used to learn beyond the textbook.
Wow.
And
That's
we are able
amazing,
to
sir.
screen so many abnormalities so that you can terminate that pregnancy. Because even if they get delivered after their complete period of the term, if the baby is suffering with certain diseases, and you know what will be the life of the parents and what will be the life of that baby. So some anomalies needs to be aborted. If you happen to see on our roads, in our childhood, we used to see Downs people. They walk like they are not harmful, but they walk like with an abnormal gait, and they are moving around in any place. And we know that that person belongs to that family, and we used to take care of that fellow. After this technological development, now we are screening almost all possible 90% of the abnormalities, and we are getting aborted them so that you are able to see the healthy population only. Yeah, and another thing, nowadays, actually, I don't advise what you call this medical tubectomy or family planning operation. Actually, after getting the second child, if you want to have two children, immediately after the surgery, they used to have tubectomy. Previously, we never suggested that because you don't know how this second child is going to survive. It's only one day baby. How it's going to end up in some problem or something like that, you don't know that. That's why we never used to suggest to get tubectomy or something like that. But nowadays, you had all the scans and almost you had eliminated 99% of the problems so that you can have tubectomy on the day itself. Of course, still 1% chance is always a problematic chance, but the technology has developed to that extent. We had seen all the parts of your baby's heart, kidneys, brain, almost all smallest parts also we are able to recognize and say, okay, this baby is going to do well. So we are almost certifying like, okay, tested in a manufacturing company, okay, tested. Sometimes, okay, manufacturing defects also comes after okay stamp also, but it's quite less.
Wonderfully put
Yeah,
it, sir.
yeah. And
So,
after that, if the patient is having any complaint, like she's leaking fluid or she's having any not having any movements of the baby, those are the only indications. Otherwise, they don't need any scan after that. Everything is indication based. If she is
okay,
having an indication, then she should go for scan. Otherwise, there is no need for any scan after
right.
that.
So, guys, so take this message, please. First thing is see through the process the way it has to be. This scans and technology, we have a lot of options, but it is meant with a purpose. So know the purpose and then go for it. This is point one. And I really like hats off to you, sir. Like you check on each report and you correlate with the birth outcome later and correlating with the calculator results. It's like amazing work because this really helps to get better insights. So I'm so happy that we have you here, and it's I'm so glad that doctors are doing this, and it's a wonderful thing. And the third thing, whatever be it, whether we have the natural and unnatural things coexisting together, always it's all about balance. So whatever is it, please accept. So So, as we spoke about a lot of conditions, doctor, I would like to conclude the session with one question like the disease burden is increasing day by day. And looking at the amount of diseases that we see, there is a panic among the population. So, having said that, on the other side, we have a lot of diagnostics and the screening ability. So, is it that the diseases are really increasing in real time, or is it the ability of the people who are able to see through and screen the diseases better is what causing all the problems into the picture? So, how do you take this?
Actually, it's from both sides. As you see, in last 20 years, there is extraordinary technological development in diagnostics. That has changed a lot in the way doctor sees, or the way doctor treats the patient. Previously, where they need a surgery, they are doing with the smallest intervention, with the smallest needle, they are doing surgeries only because of this technological advancement uh, that helps in not only detecting the diseases and also treating them early. One thing is definitely the diagnostic has grown. I can say 100 times better than the what you have 10 years back, not even 20 years. So we are detecting the diseases more because we are testing more. First thing is the patients are getting, they are able to get the test done. That's because of something. Okay, some economic development has happened in last 20 years, and they are able to get the test done, and we are able to buy the largest equipment with huge amounts of money because we are getting patients. So one side, the technology is growing, and we are able to detect more diseases in an early stage. And another thing, people are also getting, as they are having so much of medical technologies, why don't we use them? So they are living their sedentary lives and helping us to live also. So they are adding their diseases. If someone is having, his mother or father is having diabetes, they want to beat their record. Usually they used to get around 50 years and he will get it 30 at the age of 30 years. So he thinks it's okay to have a pill in the morning. It's not that unnatural, because in any family, you can see a box of tablets for each individual, and they used to take tablets. It's very natural for us. Maybe unnatural at some other time, but it's very quite natural. And they are not afraid to take diabetes pills or hypertensive pills or thyroid pills or whatever it may be. They know the medical diagnostics or medical therapies has developed a lot. So they are helping us to grow. It's in both ways. People are, what I mean to say is, people are increasing disease burden. They are increasing themselves. Previously, or in village population, the only diseases we get here is infective diseases like malaria or diarrhea or something like that. Whereas in metros, you rarely get fevers or some sort of these things, diarrheas and all those things. But they will get diabetes, hypertension. They are much worse than what he is getting. This fever may go within 1 week or 10 days, but it will stay with you. Whatever the metro or urban population is getting, that is stay with them. They are buying long-term properties. So they have to pay EMI for that.
Right.
So it's in the both ways. Disease burden is definitely increasing. And another thing is screening also has improved a lot. We are detecting too early, and it's helping the needy. But as there is, as there is services, our Indians want to use each and every service if they are affordable.
Okay. So I hope you all got the point behind, guys. We all know that purchasing power of people have really improved, and we are able to do everything that is there around and able to get things. But think about yourself. Is the purchasing power of health has improved? Have you are able to gain the kind of health by yourself or not is a question of the hour. That's where we talk about preventive health today. Having said that, and have we spoke about lots of pills and medicines and scans and diagnostics. So my last question to you for today, like if we really want to bring people to become medicine free, um, like people like you, Naresh Madhav and Hari Prashant. There are so many people who are behind the pillars of holistic nutrition training program. So how do you see that this HNTP can make a change in the way we see healthcare?
Yeah, here I'll always used to say when Suresh and me talk about this topic, I used to say him, you are selling milk. Okay, that's everybody knows milk is healthy, milk is good, and it's tested from ages. It's good. Nobody can deny that. But we are selling thumbs up here. Okay, medicine, which is easy to sell. So you got to run faster. You have to do your hard work to sell the idea of pushing the good habit into people's mind is very tough, Shah. Very tough, Shah. And I'm happy to know that someone is doing. Yeah, someone at someday has to do it, and I'm very happy to. It's always about preventive. It's not about even the famous physicians quotes always like that. You should educate people not to take medicine. The purpose of entire medicine is to educate people not to take medicine. So what he says is medicine is only necessary when you are in dire need, when there is emergency, or you can't do anything at all, and you are just collapsed like that. Okay, and you can prevent that stage. What he's saying, what he's going to say is you can prevent that stage. You don't have to go that stage to get a medicine. If you went to certain stage and you need a drug to live for every day, that means you spoil your life yourself. Leave about them some genetical conditions and all those things, but 99% of populations we invite the disease.
Right.
Yeah. Yeah.
That is a wonderful insight, sir. Thank you so much. There are a lot of questions from the audience. I would like to ask, take few.
Yeah.
So the first question is from Richa Srivastava. She's asking, sir, how do you motivate the people with no interest in any sort of physical activity? How do we actually make them motivate?
See, there's nothing like that. You have to see in yourself. Okay, if you are a good conversationalist, or okay, we can call in Telugu, కబుర్లు చెప్పుకోవడం ఎక్కువ ఇష్టం అనుకోండి మనకి. I used to say that just walk. You both go for a walk and talk something about it where you are interested in. Just keep on walking. Okay, that's the way. Actually, you are walking. That's not the part. Here, the passionate part is you are talking. If you are interested in talking or gossiping or something like that, whatever it may be, convert it into a productive activity by walking in whatever the easiest pace you can do. What I want to say is there will be definitely a passionate thing, so that attach some physical activity to that.
Yeah.
Okay, if you are watching a serial, just stand on the treadmill, keep it in the 3 or 4, do yourself, or you can keep headphones, talk to your friends, and something like that. Whenever you are doing certain thing, you need not run like anything. It's not about faster. As I said, you are not going to beat anybody. You just have to be better than yesterday. That's it.
Absolutely, sir.
Yeah,
Absolutely.
yeah. You can watch your serials. You can talk to your friends for continuously for hours and hours. And the only thing is, you can walk outside, or else you have a treadmill. You just switch on your AC, just stand on your treadmill, keep it in a 3 kilometer per hour. You can do it.
Definitely. So, guys, exercise is not something which you see it as a separate entity. When you see it as a separate entity, we fail doing it. Moving and making ourselves physically active is part of our life.
Yeah.
Find something that is inspiring for you. Pick something which you love to do, and that's what becomes your exercise. Example, dancing could be your exercise, gardening could be your exercise, it can be anything. Just check on and indulge on yourself and see what you like the most. That helps you to stay active. So we have one question from Arunasri sir. She says, sir, good morning. As the topic came on olden days and current, why C-section is increased a lot compared to earlier? How can we avoid? How this can be avoided?
It's again, it has again been because of the consumer codes. In a normal delivery, there is a chance of fetal asphyxia, birth asphyxia. Means the baby, whenever the baby is coming out of the mother's womb, there is a certain period where the baby has to take oxygen until the baby is inside the uterus. She will get her oxygen from mother. That's okay. Immediately after any part of the body is baby is moved out of the body of mother, she needs her own oxygen, and you need to deliver it within minute. If it gets delayed, there might be chances of some brain damage. So that we call birth asphyxia. It's only 5 in 100 cases, even not 5. It's around 4 in 100 cases. That may happen in 4 in 100 cases. It is a significant. But whereas in cesarean, it's only 0.2%. That's a significant difference for a gynecologist. If a person, every delivery, if she done 25 deliveries in a month, if every a single child comes out to be hypoxic or a minimally brain damaged, that's a big burden for her. Okay, you did this delivery and see how my child is doing. We definitely ask them. So there is one thing is from the technical point of view of a gynecologist, not to be supportive, but the thing is 0.2% is much better than 4%, 3 to 4%. So that is one point, technicality. And from the patient point of view, now everybody wants to write talarata, or what you call birth sign. Birth sign a baby to be on the chart. Okay, at least if they cannot change the DNA, they can change the date of birth. So they feel like he is going to do some greater things are going to achieve. Now everybody is coming with prescription from a astrologer. So they are very particular. They are sitting outside the cesarean room. Madam, you should deliver it by 1 o'clock, 1 minute, madam. Not even 30 seconds before that and after that. How could that happen? How can they expect that? Even astrologers, I used to amaze that. How they are used to be learned individuals since years. How can they suggest that? How can they want to change what we call, I don't know how to quote it from English. In Telugu, we call it Talarata. Okay. Or the Brahma who writes his story. If you change the date of the birth, you are changing everything. Maybe you are changing the alignment. Maybe it is also going to be wrong if you believe in mythology or something. If you are changing the alignments of God's design and you want to interfere in the his writing and you want to rewrite his record, so it's definitely a sin. But they are
Yes.
doing it and we are doing it. And other part is that.
Yeah.
Yeah,
Thank you.
these are
Thank
the
you.
two things.
Yeah. Probably as a lifestyle educator, I would like to add one more point, sir, to what you have said.
Yeah.
Most of the people, whoever has never walked before, once they get to know that they're pregnant, they try to make baby steps. A lot of physical activity the moment they get pregnant. Don't take stairs, don't sit down, don't do this, don't do that. A lot of restrictions and a kind of fear is what I see around people. And for these kind of people, the thing is pregnancy is a natural process. The more you utilize and use your body and use your muscles and sit down and walk up and take stairs, the more you're strengthening your muscles and making the body ready to deliver the baby naturally, which is actually missing in all the whole scenario of 9 months of overprotection. So please think about this, guys. It's a natural process. Be yourself a natural being. That's what you can end up with more of normal deliveries, along with the pointers that Dr. Sir has just given you. So there is one more interesting question from Kamalam, sir. I have a question on ultrasound, doctor. Why no two scan reports come similar? Though taken same day or a span of a week's time, no two reports never come the same. So what is the reason?
Is it about pregnancy scans or an
Uh,
abdominal scan?
I do, this is about kidney stones, sir, because I know her.
Yeah, thank you,
uh,
Jyothi.
okay, kidney stones means they are. You should get the same report. If you are getting some other report, means maybe it's from some other person's perspective, or maybe it's a technical aspect, or it could be the mission's problem. There are a lot of things, but actually, if it is a pregnancy scan, I would have said something because the measurements comes from certain system might be different, or sometimes we take not in a proper way. There could be an error of 5 to 10%. But whereas it comes to kidney stones, someone has to be wrong.
Okay.
That's it.
Uh,
That's the only reason.
Another point, doctor. Can I,
Yes,
Jyothi?
yes, please come on.
Yeah,
Yes.
it's not only about the kidney stone, doctor. I've gone for a breast scan also. I found a small lump and I went for the scan. First scan, they said it looks like a different size, 4 mm by 5 mm size and all. So the doctor said, radiologist said might be a sweat gland. So the
Okay.
doctor suggested me to go for the this skin doctor,
Definitely.
dermatologist.
Yeah. Okay.
So went to the dermatologist, and the dermatologist, she suggested it doesn't look like that. You better go for breast specialist. So it was like a panic condition for me, and again went to the breast specialist, and there again they took the scan. It's on the same day,
Okay.
and there they said, yeah, there is a lump, but it looks like an inflammatory. And I don't want to blame the doctors or anything. I'm just concerned, like how the different scan reports, how they give, and the inference they give, how panic situation it arises, and how the doctors take that report. Even for the kidney stone, it was like in one scan, it was like 7 mm stone was there, and another scan in a week's time when I took it, they said like 4 to 5 mm stones here and there.
Yeah.
One was in the ureter, and the others are 4 to 5 mm stones. So when all the reports, there is no serum creatinine and when no infection. So one doctor, he suggested to go for the this laser therapy,
Okay.
uteroscopy, and the doctor said better wait because there is no infection.
Okay.
So how come the two reports on taken, it will be the same? That's what my question is.
Yeah, first coming to this breast scan, uh, it's only the difference of use of technical words that has changed the report. Actually, both has given the same report. An inflammatory condition means it could be because of skin disease or you have layers of tissue in any part of your body. First comes skin and subcutaneous fat, and after that breast tissue or any other tissue. It's like that. So when we happen to see the disease process nearer to the skin, it could be infective or inflammatory. Both are not cancerous conditions. Okay, it's okay to go to a
Okay.
dermatologist as it is very closer to the skin rather than breast tissue, deep breast tissue. It's okay to go to the dermatologist, and they also study it rightly, and they see something wrong. It might not be a dermatological condition, and the breast specialist also told you that it's an inflammatory condition. It's not cancerous condition. So
Uh,
in any way, everybody has said that it's not a dangerous lesion, and it's an inflammatory or infective. Both can be seen similarly in image. What we get is a grayscale image of the normal tissue, where we have all the DDs, means differential diagnosis. It's like that in our exam. If we put single diagnosis, as always patient expects, you are getting my point. If I write a
yes,
single
yes, doctor.
diagnosis for a single disease, I'll get failed. I have to write two or three similar diseases which looks like them. One, two, three. First possibility this thing, second possibility this thing, third possibility this thing. If you don't write all the three, even though you are absolutely pinpointing the disease, they are going to make you fail. So it's always about the probability. In imaging, probability, you cannot pinpoint. You are not taking the tissue out of the body and testing it under the microscope. So you are just doing the macroscopic scan. It's like that. If you take lump out of your body, have you ever seen any surgeon saying, oh, this is cancerous? Never. They send the sample to pathology and they will wait for the report of a pathologist. So what does it mean? A patient having lump, a patient removed that lump and it's within his hands, and he had seen so many cases. Still, he is never ready to comment that as cancerous or non-cancerous. He'll send it to that sample, that big ball-like sample, to some other pathologist, and he will wait for that report to do further tests or further treatment, or simply he says, okay, it's not a cancerous mass, you can just go and you don't need any tests. Maybe I think you got my point. Imaging is definitely cannot pinpoint the single diagnosis. It always comes with two or three diagnoses, possibilities of one, two, three, and you need to check with some other scan, or you need to check with some other specialist, because as a radiologist, we deal with all the parts of the body. You take eye, you have multiple layers of eye. We study about each and every layer. We study diseases of each and every layer. When we had any doubt, we ask the ophthalmologist, sir, I see like this. Is this so or not? Because he is seeing only the eye. We see the entire body, entire system, all sort of pathologies. And we used to talk with that specialist in that language. We used to talk to gynecologist, we used to talk neurosurgeon. Okay, this is the smallest structure that is obstructing your view. It's like that. So coming to the point, in this breast case, everyone is right. But only thing is, it's you are more concerned about your health. It's good, but definitely good. But sometimes over concern will make you anxiety. It will take you to anxiety. Nothing more than that, and you shouldn't bother about it. As the diagnosis as written by a radiologist or a breast surgeon or someone else, nothing is of dangerous thing. It could be infective or inflammatory. You cannot rule out that. And coming to this thing, kidney stones, uh, we stones doesn't say, you know that if a stone is like a rice grain, okay, imagine it's a rice
Okay.
grain. If you take measurement from point to point, you will get 8 mm, and you just simply tilt it and take a photograph of that. What you will get? You will get some reduced length. And if you only happen to see half of the grain or the cross section of the grain, you can see only 3 mm, whereas the stone might be around 10 mm. So in ultrasound,
Okay.
particularly in ultrasound, you don't know whether you are taking longitudinal, exact longitudinal image of that stone, or oblong image of that stone, or cross-sectional image of that stone, unless you get multiple views. If we are able to screen, or if the body is able to allow us to screen in multiple planes, then definitely we'll give an accurate, almost near accurate measurement. Otherwise, 2 to 3 mm, from patient points of view, everything is significant. I know that. I'm a doctor. I know, okay, that doesn't make difference. But patient feels a difference. A 9 mm stone from a 5 mm stone, that's huge difference for a patient. But for us, in taking all the technical considerations, it is a possibility that we may misreport it as 5 mm or 9 mm or something like that. It's purely technical, not what you call under experience or under reporting or over reporting. It's not like it could happen. In both the cases,
Okay.
one thing is technical issue, and another thing is you don't have anything. The people had described it in their own technical languages that made you panic.
Thank you, sir. Thank you so
Yeah.
much.
Thank
It
you
is
so
as
much.
simple as it, guys. Like the other day, one of the student interns got her activity tracking to me and said, "Ma'am, I walked only half a kilometer, but it is showing some 250 calories burned. It is given by a machine." But it is a false data. See, be it a report or a machine or be it anything, end of the day, we humans, we have the capacity to analyze and take a, a
Yeah,
call
it's a
on it.
good point. It's very valid point. At the end of the day, we are human. To err is to human. But for the patient, it's very tough to take that point. When you are patient, I know that. But to err is to human. Yeah.
Yes, sir. So we'll just take one last question, sir. But there's a lot of appreciation for you from Karuna. Thank you, sir, for enlightening us with your tremendous knowledge and experience. Dr. Neetu says, "Thanks a lot, sir, for sharing your wisdom about so many clinical points. Love to listen you again." We'll just take one question, sir, before we wind up the session. It is from Samata. She says there is an increased number of cholecystemia cases and also renal calculi. So, what is your opinion on this increased prevalence, and what can we do for this? Your perspective.
Cholecystitis means it's about
Gallbladder
gallbladder
stones, sir.
stones.
Gallbladder
Gallbladder
stones and
stones. Yeah,
renal stones.
yeah. Actually, it's increasing. Previously, we used to have four Fs. We call fatty, female, fertile, and maybe another F I forgot. That could be fourth F.
Okay.
Yeah, that's the only case we used to see gallbladder stones. But right now, because of our dietary habits, there is a lot of change in. There's definitely an increased incidence of gallbladder stones. I think it's only dietary changes and the timing also.
Okay.
With the growth of this junk food in our hand, we are always having some supplement in our hand. So we are chewing something, and we are not designed like that. Our biological clock to digest the things has also got confused. So that might be the reason the junk food or whatever it may be. It's about, I think it's about food, right? Not we are taking not right kind of food, and not at right time also. Gallbladder, whenever you take certain meal, gallbladder contracts and send the juices to digest the food. Even fasting for long hours also make the make the juices stay for long. These gallbladder juices appears like a thick fluid, jelly-like fluid. If you keep it there for 2 or 3 days, they'll get solidified and they'll make stones. So prolonged fasting is also one of the cause. Especially in Indian females, we used to see there used to be a lot of vratas and all those that. So they used to starve a lot. I don't call it fasting. They used to starve a lot so that their gallbladder remains distended. It needs to be time to time get contraction so that it can push the contents out of it and get the new collection of the juices. If you keep it for 3 or 4 days, then it will start get solidifying. Means it becomes solid and breaks up like powder, and after that it will make stones itself. And
Yes.
even about kidneys also, I had seen. I used to say my patient, all my patients, sir, I had kidneys. When can I expect to lose this disease? I used to say, see the kid when the kidney. I had seen any kidney. When the kidney learn to make stones, it keeps on making stones. Whatever you do, you just have to wash it off regularly. Take plenty of water. That's it. You can do. That's true. That's true. That might come at a later date. But my experience is whenever your kidney started making stones, it won't sit and stand still. It will keep on making the stones. Only thing is you can do is you need to wash out every day by taking plenty of water. Plenty of water doesn't mean 5 to 6 liters. It's at least 3 to 4 liters is more than enough. People are nowadays taking a lot of water, 5 to 6 liters a day. That's very dangerous. That's not at all advisable, and it's any excessive is dangerous.
Yes. So thank you, sir. So this people, especially who are fasting during this Kartika Masam, make a note of this, guys. Even if you fast and if you don't eat for the whole 30 days, you will end up making gallstones. We never know.
Yeah,
So food changes and your
yeah.
lifestyle.
Once and keep them know that once they know how to make stones, they will keep on making them.
Exactly, sir. So
Yeah.
you have the ability to make the stones because that's what your lifestyle is all about. And if you don't want to make any more stones, get back to us. We'll show you what is the right way of living. So thank you so much, sir. It was wonderful to have
Yeah.
you here and for sharing such an insightful, in-depth details to us. Sir, Dr. Suresh, are you there around? If you're there, please add few lines to us today. Are you there, sir?
Yes, ma'am.
Jyothi, can I ask one question?
Yeah.
Okay, one second. Yes, sir.
Yeah, take the question first.
Okay. Yeah, please go ahead. May I know
Yeah,
who's this?
Sandhya.
Yeah, Sandhya. Go ahead.
Yeah, good afternoon, sir.
Good afternoon,
Uh,
madam.
yeah, so you've been in this field for from past 2 decades, right?
Yeah.
So, how do you see this disease reversal concept in your early days and now in this present day? So, you must be having two different views, right? I
Yeah.
know both of you, Dr. Suresh sir, and you, believe this concept. But
Yeah.
how do you see the change in those days and these present days on this reversal revolution?
Yeah, definitely it's a good concept and it's catching up. I can say that. Previously, even we doctors don't know that diseases can be reversed, and even most of my colleagues won't believe even if I say diabetes can be reversed or something like that. Lifestyle diseases can be reversed. They don't believe that, and it's at least nowadays they are thinking it can be reversed. It's a good trend. What people like you are doing is even educating doctors. I always say we never think about preventive things, or we never think about curing a person. We just keep on treating the patient, not the patient. We are just keep on treating the disease. And now we have more super specialties and super subspecialties than the diseases itself. It has grown to that extent.
And one last
Okay.
thing, sir. As a radiologist, what is the toughest challenge that you face?
Like what?
I come across so many radiography
Yeah.
results, and as radiologist, common challenges that you have with the patients and doctors, the conflicts.
Yeah, in any profession, there will be a conflict. whether you accept it or not. There will be a good day and there will be a bad day. But the end of the day, uh, luckily by God's grace or something like that, there is nothing has happened so that I can remember the event. I just manage it like that. There could be bad days, there could be good days, but uh, the thing is, I am passionate about doing my job, and I never. It usually some of my colleagues has encountered with some problems, but it doesn't happen with me. Maybe I'm lucky, or maybe I'm doing hard work. I don't know, uh, because I'm not. If I'm not able to recollect immediately, that means I never been put to that much challenge. I think so.
Thank you, sir. Thank
Probably
Maybe
you,
I'll
the
sir.
add
wrong
one
question.
point to you,
Yeah.
sir. Like
Yeah.
Sandhya and to all the audience, sir is one person. While doing the technique, he does the history taking of the patient. This is something which we never get to see or hear from any of the radiologists. Talking to the patient and understanding them, analyzing with the existing current report, and then correlating with the outcome later is something it calls upon the passion that is having. That's what makes him place in a better place.
Absolutely. No subconscious memories for sir.
Thank you, sir. Sir, over to you.
Jyoti ma'am, can I say just one thing, from
Yes,
my heart
please.
to Dr. Pavan? So
Yes, yes.
the thing he said, like, we treat the disease, not the patient. Matlab, it is so true, sir. So many takeaways. I mean, every word you said is like, so powerful, impactful. I mean, making us think. As a holistic nutrition, as we are taught, like, knowing the root cause. Here we are treating the patient and the disappear. I mean, so disease can be reversal of the disease can be expected. Thank you so much, sir. You took my question as well. Thank you.
Welcome.
Thank you, Samta. Dr. Suresh, sir, over to you.
Yeah, sure, madam. One technical question, and next is my commentary. Dr. Pavan sir, where is the heart located? In the chest cavity or in the thumb?
It
Great too.
depends. It depends. I can start it from anywhere. I can start it from anywhere. Yeah.
Yeah. So the reason why I asked that question is he scared the entire class, madam. Okay, the entire bus full of students. He eloquently pointed out that the heart is there in the big toe of our foot. Okay, that is
Okay.
why Krishna died. Okay, and he weaved a wonderful story with anatomy, physiology, and everything. And everybody ran into the library and started reading.
We used to do
Okay,
the
and
lot
he
of stuff
literally
like that. Yeah. Yeah. Suresh,
he
one thing
literally plays with medicine.
yeah.
Yeah, yeah.
Suresh, one thing I recently found is uh, human race got dominance over this entire planet. People think it is because of our brain.
Hmm.
Is it so? But actually,
No.
recently I find it out that it is our knees that made us stronger than any species. Because only that's true, madam. That's true. I support my point. As hunter or gatherers or something like that, the human is the only animal that can consistently run for hundreds of kilometers. No animal can run that distance. So as you are able to move from places to places, hundreds of kilometers, thousands of kilometers, travel in 1 week or 10 days, you are able to sustain, your species is able to sustain the bad weathers or worst conditions under you. You are able to search the better places to live. That's how your species has moved from place to place, protected itself. It's only purely because of muscles around your knee. That's where you are. And after that, mind has taken over like your computer.
Yes, sir.
That's it.
The
If you
the
don't have
absolute
strongness,
reality.
if you don't have strongness, you would have been extinct because you are not strong. You are not faster than any animal in the forest. Then how you are able to sustain for millions of years? Forget about these years, intellectual years. Forget about this. When you are just like any another animal, what is your ability that made you to survive and outpass them and dominate them? It's only your muscles, not brain.
Wonderful, sir. I just loved your last line. It was so so guys, it's not the brain, it is not the stress. If you want to overcome all these things, take ahead and give charge to
Move
your
your muscle. Move your muscle. That's
exactly. That's what makes you move a lot, make you active, prevent you from all the diseases, and be the crowd along with us a medicine-free millennium, which we are looking forward. Thank you so much, sir. Thank you, Suresh sir, and thank you, Pawan sir, for having here today. It was such a lovely session. All our audience has really loved it with all the beautiful insights. Thank you so much, and
thank you
thank
very
you
much
guys for
for having
joining.
me. Yeah, yeah. Thank you very much for having me, man. It's
Thank
very
you, sir.
nice to talking to you all. Oh, it's been a long
Madam,
awaited
one more
case,
minute.
even for me also. Yeah.
Yes, sir. Please, sir. Go ahead.
Yeah.
I can add you,
So
sir.
I don't know how many of you are able to get his sarcasm. See, one of the answers, I mean, I was laughing all throughout because I know what he's getting into. But since he has to be more formal and be a doctor like, you're unable to get. So when he answered that lady, that pregnant lady, what will happen if there is no gynecologist or a radiologist? Will that stop? I mean, I know where it leads to and what it could have been, right? What I mean to say is, so the reason why I asked get Pawan sir for one discussion is the depth of the knowledge. I mean, he just touched the tip of this scanning, right? Why the scans are more and all these things, and it is just only tip of it. And one thing I encourage, since most of them are our HNTP students, one thing that you can learn from Pawan is, right? Don't shy away from learning. Okay. So even when he was doing his post graduation, when we go to visit him, you know where we used to sit, because he will do all other postgraduate students' job. So they think that okay, he is dumb. If we give him duty, yeah, we can take leave, and he will use every chance of doing the maximum number of scans. I don't even recollect any other radiologist student doing those many number of scans and that much of work in those 2 years. Okay, even to spend time with him, we used to go to his lab and sit there and used to talk, and while he was working. Okay, that passionate he is about. And the first point that he mentioned about it is all about like passion. Fitness is a byproduct. Health is a byproduct. Okay, so once you are passionate about something, and the question for which he answered about from Richa, right? Mix something with passion, so automatically your results will come automatically. Okay, so wonderful, well done. I mean, I was worried, but it has come out really good.
తర్వాత
Thank you,
బయటకు
sir.
వచ్చి తిట్టావు కదా.
Absolutely
ఆ
not,
తర్వాత
sir.
ఆ తర్వాత ఉంటుంది. Okay, thank you, ma'am.
Yeah,
Thank you, sir. Thank you for the wonderful
welcome, ma'am.
story behind the scenes. And thank you, Pawan sir, for joining us today. And thank you each and everyone who has been part of this wonderful session. We'll come and see you next Sunday with another interesting topic. Bye bye. See you all. Have a good day.
See you, man. Have a